Welcome to Adapting Class and thank you for joining us. Um, some few concepts related to oncology. These are really difficult topics. But they're very interesting. It requires some critical thinking when they ask you those questions. You cover everything. So just a few 10 questions, but to illustrate some concepts you need to know for the NCLEX. Practice questions on oncology. And I know the answer choice that most people will select. A client with multiple melanoma has calcium level of 12.5 milligram per deciliter. Which provider order should the nurse anticipate? Test taking strategy. Just go for the buzzwords, right? I have a calcium of 12.5. What do I expect? Normal saline, seizure precaution, vitamin D, and hydrochlorothiazide. I know the answer choice most people will pick. They're going to pick this. But when you pick it, you're not thinking. You're not thinking about the question. You're not analyzing up the question. You saw seizures, you say, okay, it's a bad problem. I'm going to choose it. Wrong answer. You should expect that in NCLEX. They will give you things that does not answer the question. When you pick this answer choice, it means you're not analyzing the content. You're not bringing your content. Calcium, when calcium goes up, your symptoms go down. There is no way hypercalcemia will cause seizures. But I know a lot of people will pick this answer. Why? Because they saw seizure, they think it's a bad problem. It does not answer the question. If you need more like this, check adapting because this is the questions, this is the way I set questions to make you think so that they don't trap you. Calcium that is elevated will not lead to what? Symptoms that is upper symptoms or seizures. You should not pick it. Most people with hypercalcemia, their symptoms go down. So bone pain, depression, right? Renal stone, right? Those things are going to go down. They're not going to be hypersensitive. Vitamin D is going to increase your calcium. Why do you want to pick it, right? Why do you want to pick vitamin D or calcium? It's going to increase your calcium. Hydrochlorothiazide also will increase your calcium. And the side effect of hydrochlorothiazide is hypercalcemia. Therefore, you live with that. When you have hypercalcemia, you need to flush the system. So you give them a large amount of water, fluid, and then you give them diuretic. The diuretic is usually furosemide. It does not cause hypercalcemia. Any thiazide, hydrochlorothiazide, chlorothalidone, all of them causes hypercalcemia. So this is the purpose of this question. I made a YouTube short about it, but it's designed to test you so that you don't get trapped. Don't get trapped. Explanation here. Same concept. Which dietary choice is best for the patient? The word is best. So which dietary choice? Nurse is caring for a client receiving what? External beam radiation for head and neck surgery, right? Which diet choice should be given to the patient? Hot sauce and crackers, citrus fruits and yogurt, mashed potato, scrambled eggs, chips, and salsa. Think about it. Put down your answer if you know. But think about it. The buzzword in that question, external beam radiation. And what are we radiating? Your head and neck. That means I'm radiating your head and neck. That means all your head and the neck is going to get radiation. You're going to have problem. Then you go back to your content. If you need more videos on oncology, some of the key facts, that is where the question will come from. You can't memorize, you got to know the content, and they will use the content to create question. So what do you think is the complication of head and neck? When they ask you question, they know what they're doing. They're trying to trap you. But at the same time, use content. The common signs and symptoms of radiation is what? That's what you need to know. And this is a stomatitis, right? Your mouth is all red, the cracks and the inflammation. And so you cannot eat anything. What can't you eat? Stomatitis, what should you avoid? Anything that has acid in it, you should avoid it. Anything that is spicy, you should avoid it. Those are the things that you tell the patient. Anything that is too hot, you tell them to avoid it. And you give them high calorie. Therefore, hot soup and crackers, no way. Citrus fruit, too much acid. Mashed potato is soft. You need to give them something soft, blended. Chips and salsa, no calorie. They're not supposed to be eating it. So that's inappropriate. And therefore, the right answer, the patient is going to eat this one. And this is caring for a client receiving chemotherapy. Which statement by the client require immediate intervention? I have been feeling really tired lately. If you get chemotherapy, you become anemic and therefore you feel tired. I have had a fever of 101 since this morning. Your white can go down. You became neutropenic. If you feel your fever, that's a bad problem. I sometimes feel nauseous after my treatment. That is all chemotherapy. I noticed some air falling out when I brush it today. Expected loss of follicle causes air loss. So this is unexpected finding. This is fine. Fever in the patient having chemotherapy is dangerous. So that one is bad. And this is educating the client undergoing chemotherapy about ways to prevent infection. Which of the following statements should be included in the teaching? Select and apply. Rewrite the question on your own. What does that mean? Patient is getting chemotherapy. What teaching do you provide to prevent infection? Avoid crowds and individuals who are sick. Wash hands frequently with soap and water. Eat fresh vegetables and fruits without washing them. Get all recommended live vaccine immediately. Monitor for signs and symptoms of signs of infection. What do you think? If you answering this question and you see it, what are you going to select? What will you select? Avoid crowds, wash your hands, eat fresh fruit and vegetables without washing them, get all recommended vaccination, monitor for signs of infection. The key thing is to prevent infection, right? So neutropenic precaution. This question is the same thing as neutropenic precaution. So what kind of neutropenic precaution are you going to do? One, you should avoid crowds. Okay, avoid them as much as possible. Two, you should wash your hands with soap and water to avoid infection, right? C is a trap, right? You have to wash them thoroughly before you eat it. So fresh vegetables and fruits need to be washed, otherwise you get sick from it, listeria and the rest. Get all recommended live vaccine immediately is a trap. They cannot have what? A live vaccine, right? They should not get any live vaccine. Therefore, this is a trap. Monitor for signs of infection such as fever and chill. So those are the things the patient, but these two is not indicated. A client with advanced lung cancer is experiencing severe pain despite being on the prescribed opiate regimen. Watch for questions about pain management in a cancer patient. Yes, lung cancer is getting what? Prescribed dose of opiate, right? And it's still not helping. That means you got to do something. Increase the frequency of the opiate, right? Assess the patient pain and cause the physician. Encourage the client to use non-pharmacological means. Switch to non-opiate. The concept here is when you have cancer, you got to give them, you should not be limited how much pain medication you give them. You make them comfortable as much as possible. Therefore, if they're getting long-acting medication and it's not working, it's your job to talk to the doctor. Increasing the frequency without not talking to doctor is not going to help. Encourage them to use non-pharmacological means is not going to help. And then switching to non-opiate, they are on opiate. Therefore, if you switch to non-opiate, it's going to make things worse. So B is the right answer. Which statement by the nurse is correct? A client undergoing radiation to the breast asks how to care for the irradiated skin. You have to know this, how to care for irradiated skin, because if they don't do well, they get infection, they get the wound, the skin does not heal. Use a healing pad to relieve discomfort in the area, right? You put it on, you feel good. Apply unscented lotion to the area, but avoid applying it right before treatment. Is that okay? Scrub the area with mild soap and washed cloth daily. Expose the area to sunlight for the short period to promote healing. You should never expose that area to sunlight. It will worsen it. You should never put heat pad on it. It's going to make it worse. You should not scrub it, right? You gently let the water and soap run on it. You can apply lotion, unscented lotion, but not before you undergo therapy. So that is the key. That is that question. Those are therapy questions. Okay. Which assessment finding require immediate intervention? And then a client with advanced lung cancer is experiencing superior vena cava syndrome. You have to know what is superior vena cava syndrome. So this is if you have lung cancer, if you have cancer and your vessels are on your top, superior vena cava is the vein in your neck and it run across. The inferior vena cava is here and the superior vena cava is here, but both of them join together, right? So if there's a tumor here, it's going to push on the vein. It causes venous congestion. So this is just a venous congestion. It's called superior vena cava syndrome. So if you have venous congestion in your face, in your neck, what do you think you're going to expect? It's like a heart failure, right? That is the key. Congestion in your neck. Your face, you're going to have edema. That is expected. Your neck veins is all going to get bigger and distended. That's normal. Your neck will get swollen, but as soon as you have breathing and stridor, I need to intervene. You're going to get headache and dizziness. But the question is prioritization, right? All of them are expected, but one is the worst of all. This is when you develop difficulty breathing and stridor, you develop complication from the superior vena cava syndrome. But facial edema, neck vein distension, headache are all expected finding. Which intervention is most important? A nurse is caring for a client with leukemia who has a platelet of 4,000. This is another trap, right? If you don't look at it, you pick something wrong. You just have to answer the question that is being asked. The patient is on what? Platelet is 40,000, which is less than 150,000. That's the normal. So this is the problem, right? And when your platelet is low, you're going to have bleeding issue. You see what I'm doing? I'm not even looking at a question. Therefore, I'm going to look for anything that is bleeding. I'm not going to get trapped because I'm analyzing the question. Is the most important. 40,000 of platelets, I'm going to bleed. Signs of infection, I'm not bleeding. Walking, I'm not bleeding. Soft toothbrush, it means I want to prevent bleeding. Protein diet, it has nothing to do with the platelet. You see these kind of questions. When you see them, don't look at the answer choice. Just look at the content the question is asking, and you'll be able to answer it. Which statement by the client indicate correct understanding? Is the same thing. And this is educating a client receiving chemotherapy about preventing infection. Same thing. This one is avoiding crowd, right? I should take my temperature once a week. Is it okay? If I get a fever, I will take ibuprofen. Is it okay? I can still garden as long as I wear gloves. What do you think? Which one is correct if you want to prevent infection in this patient? Which statement means they know what they're talking about. You cannot garden. Even if you wear gloves, you have high risk of getting toxoplasmosis and the rest. If I get fever, you should let the doctor know. It's a bad problem. I should take my temperature once a week. It's daily. Once a week is wrong. Therefore, we left with this. You should avoid crowds. And the last question, guys. A client receiving cisplatin for ovarian cancer report ringing in the ears. What is the next priority? So taking some medication for ovarian cancer, I have ringing in the ear. Even if you don't know what the medication does, I've given it to you. I told you it causes ringing in the ear. What would you do if you're the nurse? Reassure the client that this is the temporal side effect. That means it will go away. Encourage increase in fluid. Notify the healthcare provider. Assess for signs of nephrotoxicity. If you look at the answer choice carefully, there's two answer choice that is saying the same thing. Cisplatin causes autotoxicity, right? That's what the patient is having. And it also causes nephrotoxicity. Increasing fluid is for the nephro. Looking for nephro is for the nephro. Therefore, these B and D is saying the same thing. Now you're left with C and A. Think about it. Patient is having ringing in the ear, and you saying, well, it's a temporary side effect. Autotoxicity is not temporary side effect. If you don't do anything, it's not going to go away. Complete hearing damage. So you should notify the healthcare provider. This is adapting class. Just 10 quick questions on oncology. And you can see that this is a concept that will help you if you really understand what is going on. So watch the way the question is framed. Think about what the examiner is trying to do, ask you, and think about it carefully. If you don't see it in the question stem, don't pick an answer choice that does not answer anything in the question stem. Take care of yourself, and good luck in your exams. If you need more, just subscribe to Adapt and Class or join our membership.